All right, good morning and welcome to those who just joined the webinar. Please stay online and we will start shortly. All right, so hello and welcome everyone to today's exciting webinar on mental health and well-being in healthcare careers. We are so glad that we have you here. So now, we all know that healthcare careers can be demanding. But did you know that taking care of our mental health is just as important as taking care of our patients? So today we are diving into the world of well-being in healthcare. And to guide us through this important topic, we're joined by our true expert and advocate for mental health. So please join me in welcoming Dr. Babikar, a powerhouse in healthcare education with over a decade of experience. She's not only a lecturer and program leader of healthcare management at GBS Dubai, but also a passionate researcher currently pursuing her second PhD. Yes, you heard that right, her second PhD. So her research is dedicated to mental health in higher education, and she's deeply committed to exploring how we can better support the mental well-being of both students and professionals in healthcare. So Dr. Iman's expertise spans in a wide array of topics from healthcare sciences and diagnostic medical imaging to person-centered care and AI simulation in healthcare education. But beyond her impressive academic credentials, what really sets her apart in her passion for promoting holistic healthcare approaches and mental well-being across aspects of healthcare. So, whether you're a healthcare professional or someone interested in the field, you're in for a treat. Dr. Iman will take us through the strategies, insights, and tools that can help us all thrive in our careers while maintaining a healthy mind. So, let's give her a warm welcome. Dr. Iman?
Hello, Renu. Thank you very much for the lovely introduction. Thank you very much, and thank you for everyone who's attending. I cannot see the numbers, but I'm sure that we have a quite good number of audience. Welcome everyone, and I hope we can have a lovely, nice session together. Let me start with sharing my screen. I will start right away. Okay, let's start. So, welcome again, everyone. This is me, Dr. Iman, and I'm going to take you through this nice, lovely webinar. I hope that everyone will enjoy this webinar. This is a very important topic that we need to focus on and just put some light on about mental health, and not just any mental health and well-being in general, especially in healthcare careers and healthcare professionals. This is what we're going to talk about today. We are going to cover some of the important aspects about mental health, and we will focus more on the effect of mental health on healthcare in general and the facilities and the organization. We will speak about, we will have different terms. We will understand what is mental health, what are the causes and the risk factors, strategies, and for promoting mental health, the role of leadership and policies, call of action, and we will conclude at the end by having some questions, and hopefully I'll be able to answer all of them. So starting first, this is a general question I always like to ask everyone when they are attending such sessions like that. How is your mental health? Do you know what's mental health? Are you aware of mental health and what you're supposed to do if you find out that you are suffering from something and you're not sure where you have to seek for help or for guidance. So this is an important question to ask everyone, especially when we are focusing today on healthcare professionals. And I really don't like to start with the sad story, but this is a reality and this is a sad story that happened in the US. You can see here we have Dr. Lorna, and she was in the U.S. in New York during the COVID-19 during the pandemic. She worked for long hours, and she was a dedicated, excellent doctor, but she struggled from a severe burnout and mental disease. Unfortunately, feeding from stigma and having she hesitated to seek for help, and unfortunately, she struggled and she ended up her life by suicide in April 2020. So from that story, this led to the Dr. Lorna Care Healthcare Provider Protection Act. The U.S. actually established a new law designed to improve mental health support for healthcare professionals. So from here you can know and you can see the importance of mental health for healthcare professionals. Healthcare professionals can go through a lot and they can do this in silence. And this is what we are trying to promote now, that mental health, it's very, very important and vital for healthcare professionals. We'll speak about this in general, and from this story and from this act and law, there is a lot of organization strategies was changed and was established in both nationally and internationally. We'll speak about this at the end. And in general, mental health is essential, as I just mentioned. In healthcare, it directly impacts the patient care. As I always say, you cannot take care of anyone if you don't take care of yourself. It's important because it has a great impact on the workplace performance and the overall well-being for yourself, for the patients, and for the community. Healthcare professionals face a high level of stress and emotional changes. This also demanding a very long hours and extra workload, making them vulnerable for burnout, anxiety, and depression. By prioritizing mental health, this will enhance the resilience, decision making, and ethical practice while reducing the errors, which is going to improve the job satisfaction for healthcare professionals and for the patient itself as well. This also will give the strong mental state will foster supportive work environment, and this will promote work-life balance, which I see a lot of healthcare professionals struggle to do this kind of balance between work and life in general, and encourage self-care, ultimately benefiting both professionally and for the patients. We are going to address these things now, and by addressing the mental health in healthcare institution can create more effective, compassionate, and sustainable workplace to make sure that we have a healthier environment for both our staff and for the patients. So let's take a minute first to have like a quick small definition for mental health. What is mental health? By the WHO definition in 2023, mental health is a state of mind well-being, which this individual including the scope of stress, work productivity, and contribution to their communities. Well-being as a term itself, it's an holistic approach. So I'm talking about in general how I can see this person as in a whole health and well-being. It's a holistic approach which includes the emotional, psychological, social aspect in health. And these actually some of the unique stressors and healthcare professionals that you can see or you can face, as for example the long shift and unpredictable hours, and this is a very very common one. In many healthcare professionals, work extends for hours, leading them to fatigue, and this will reduce the congestive for the function or for the work. Also, there is a high emotional demand in healthcare professions because they are dealing with the critically very ill and critical cases and patients. This will be by, for example, delivering bad news or witnessing a suffering patient. This will actually drain them emotionally. Patient outcomes and ethical responsibilities in healthcare workers, they are responsible for their life or even for their death decisions sometimes, which can contribute to anxiety and stress and self-doubt at sometimes in their job, exposure to traumatic events, and this could be something casually happening in healthcare careers because there's a continuous exposure for suffering, medical emergencies, patient death, and this actually increases the risk of having a trauma after that. And we will speak about this in a minute. We have also the workplace structure and the pressure from the workplace itself. We're talking here about the managemental level, the demanding and work nature of healthcare setting. It can lead to some kind of stress and burnout, and this is actually very, very common where we can see in healthcare professionals. Now, some common mental health challenges that can be seen, and this is actually the top four of them. We can see the burnout, anxiety and depression, compassion fatigue, and post-traumatic stress disorder. Just a quick definition for them. The burnout is a chronic workplace stress that is leading for exhaustion from work, and this is also will lead to reducing in the performance of the workers. The anxiety and depression, this is the persistent feeling of being worried all the time and the fear of that effect. This may cause also for like a severe, some of them may cause the severe depression, and the anxiety may cause them to end their life. This is where we have to stay and stop and see what is the level of stress or the anxiety they have. The compassion fatigue. Also, this is an emotional exhaustion from the prolonged exposure to others' suffering. So you know that healthcare is a very, very tough environment, and being there with patients most of the time, it's actually very, very exhausting for some of the healthcare professionals. And the most important, and I think it's one of the important one, is the PTSD, which is a post-traumatic stress disorder. This is a mental condition where it develops after experiencing some kind of or witnessing a trauma, and these can lead to some kind of exposure for physical trauma. It could be a sexual assault, a natural disaster, or an accident. So this is happening after being exposed to any kind of a trauma. Next, we're going to speak about the causes and the risk factors. There are so many causes and risk factors can be contributed to mental health and healthcare professionals, starting with workload and staff shortage, emotional tolls, workplace culture, lack of work-life balance, and ethical dilemmas. And I'm going to speak about each one of them briefly, and I'm going to give an example and case study for each one of them. But starting with the first one, the workload and staff shortage, which is a very, very common issue now. You can face them and see them in a lot of healthcare professionals or healthcare facilities. Long working hours, high patient loads, and inadequate staffing. This will contribute to the physical and mental exhaustion. And the staff shortening actually will be handled, meaning handling more patients. This will definitely increase the stress level. There is a study in the UK by the NHS from 2023 that reported that over 100,000 of the staff positions were unfilled. That means there is a shortage in the staff, leading to a longer shift and higher stress. The burnout was reported 45% of UK doctors and 50% of nurses. They were suffering from a burnout due to the excessive workload, and this is from the Royal College of Physicians in 2022. The second one is the emotional tolls of patient care. The healthcare professionals work and witness suffering, death, and trauma regularly, and this is leading to a emotional compassion fatigue and secondary trauma. The high emotional investment in patient care, this will lead to moral distress when outcomes are very poor. And one of the studies also in 2017 by Millers found that 25% of the ICU nurses develop a PTSD symptoms due to the constant exposure to critically ill patient, which we can understand how the ICU can be a very difficult environment for the nurses. The emotional tolls increase the absenteeism and the staff turnover. And as healthcare management perspective, this could be a huge issue when it comes to healthcare facility. Absence of the staff and the turnover, this will lead to a misbalance in the organization structure. Third one is the workplace culture and stigma. And this is also something very common. I don't know about you, but I'm going to talk about this very frankly, that we have this fear or scare to say or to talk or to just mention that we do have some kind of mental issue. And thank God now lately people are so aware, and we have a lot of awareness now. Seeking mental health support is often stigmatized by the healthcare, leading to many professionals to suffer in silence. And as in a culture which is very tough to discourage the self-care, making it difficult for workers to admit and to say that we have a stress or we are going through a burnout. A case study that is in 2021 found out that 50% of the physicians avoid seeking mental care due to the fear of professional consequences. 50% of them. If you just look at this number, this is huge. Half of them are scared or afraid, or they have this fear of seeking the professional consequences. And doctors with mental health issue, they also fear job loss because of the medical mental issue or the medical license restriction. Well, you put yourself also in the other hand, if a patient had to know or the other colleagues had to know that this physician or this doctor is suffering from mental issues, this could also lead them to the fear of they may lose their job, they may not be trustworthy as well. But that is not true, of course, that is not true. The lack of work-life balance, there is also a huge issue when it comes to long shifts, night shifts, working on weekends, overtime. This is also leading them to leaving a very little time for personal well-being. Work-life imbalance leading to exhaustion, relationship problem, and decreased job satisfaction. And this is not only applicable for healthcare professionals, this is for all employees. A study was done and in 2019 found out that 66% of the nurses reported that they were struggling with work-life balance, and this is leading them to having higher depression rates. The last one will be is the ethical dilemmas and the moral injury. Moral injury occurs when the healthcare workers must act against their ethical beliefs. We know very well the importance of ethics in healthcare um, profession in general. This is the number one, what we say, this is the first priority for us is ethics, confidentiality. So this is a very struggling issue when it comes to the ethical dilemmas when they have to do something against their ethical beliefs, such as denying care due to financial constraint or lack of resources. Imagine you have a patient and you see them suffering, you're trying to help them out, but because they cannot cover the service financially, they don't have an insurance, they lack of resources, you cannot provide the service or you cannot provide the medical help for them, you may feel that this is actually against your ethical beliefs, although it may be the organization policies. But this is also just an example. Ethical distress is common when life-saving treatments are unavailable or it's difficult, especially when we have the end of life decision must be made. And this is also very, very actually hard for medical or healthcare professionals to decide. In a case study done by Dean in 2019 by the British Medical Journal found that the emergency physicians frequently experience this moral injury and they are unable to provide adequate care due to the resource limitation. What happened that these physicians feeling the guilt and helpless, leading them to a higher rate of anxiety and depression. So these are some of the factors, and now we're going to see the impact of this healthcare or mental health to these professionals and how it will impact them. The impact of mental health could be in a different level. We'll speak about personal level, professional level, and organizational level because it's important to see the holistic image. We want to see how it's going to affect them on personally, the professionals, and professionally, and how it's going to affect the organization itself. So let's see how the personal impact. There will be a lot of impact. Actually, we covered some of them, but we'll highlight now the most important impact. This is the increase of mental health disorders. The healthcare workers experience high rate of anxiety, as we mentioned, anxiety, depression, the PTSD in general. than the other population. If you compare them, they suffer more than the other population. In COVID-19, for example, we're taking this study. There is a study done by the 2021, and they found out that 39% of healthcare workers reported symptoms of anxiety, while 34% experienced depression during the time of COVID-19. And I can relate to that because the time of COVID-19, it was a mental health disaster for everyone, but the majority of that was for healthcare professionals. The other factor, the other impact could be the burnout and emotional exhaustion. This is also defined by the Maslach later by 2016 as a physical and emotional exhaustion, depersonalization, and reduce the personal accomplishment. In a case study done by in the junior doctors in the UK in 2020, this is also by the British Medical Journal, they found out that 80% of the junior doctors reported burnout due to the long shift, lack of sleep, and pressure from the supervisors. And this is actually something very real that you can see in different healthcare facilities. Let's see the impact on the professional. What is the professional impact? This is actually it's a very important topic that we have actually to highlight because you are now risking the quality of patient care. As I mentioned here in the presentation, it actually leads to the decreased quality of patient care. The burnout and mental health challenges reduces the concentration of the workers. This increases in medical errors, and this will definitely increase the patient satisfaction. And there are several studies and case studies that is published in this specific topic. There is a research in 2018 in Mayo Clinic. This is actually found that the burnout physician were twice as likely to make medical errors compared to those without the burnout. So we have a really high risk here. And there's another survey done in the US. 7,000 doctors reported that the depression and anxiety lead to decrease in patient safety, and this will definitely increase the misdiagnosed rates in 2019. So this study also was published, and these are actually big numbers where we should actually pay attention to that, do more research, and start to make some change in there. Then we have the higher turnover and workforce shortage. Mental health challenges increase absenteeism, as I mentioned. You see that the healthcare professionals, when they start suffering from mental health, you will see that they're absent. There's a lot of resignation and the workforce shortage now, which is impacting the entire hospital efficiency. In a case study done in 2022 with the National Academy of Medicine, they found out that 33% of nurses left their job due to stress, burnout, worsening staffing crisis in the hospital. And we all know what's the issue when we are short-staffed in the hospital, especially with nurses. The next impact is going to be the organization impact. Let's highlight some of the organizational impact and how the mental health will impact the organization. Starting first with the financial cost to healthcare institution. It is costly. It's going to cost a lot if the mental health is not well taken care. Increase of absenteeism. So if your staff are not coming, we have lower productivity, we have more turnover, and this will also cost the healthcare organization millions, or I can say billions of dollars, euros, or whatever. So in a case study, also this is by the NHS, they have a comprehensive analysis that is done by the Center of Mental Health. And this is found out that the overall economic and social factors of mental health for staff could reach up to 110 billion euro in a year. This is annually. That's a lot. That's a lot of cost to try to work out and to find a way to provide the best mental health for all the healthcare professionals. The other impact will be the stigma and workplace culture. We spoke about this briefly before. Many healthcare professionals fear seeking for mental health support due to the stigma, due to the culture. They are still fearing and scared of saying that we do have a mental health issue or a problem. There is a study done in 2021, and they found that 50% of physicians avoid seeking mental health support due to concerns about career consequences. These consequences could be the loss of their job or the loss of the restriction of their license, for example. So this is actually a very huge impact on the organization. If you think about it, this will impact the quality of service. This will impact the patient care. This will impact the finance of the organization. So they're all having different impact, but they all come at the end as a holistic impact for the whole organization. Now, we know the issues, we know that we have problems here, we have some numbers, we have some analysis here and there. So we know there's something need to be done now. What are the strategies now for promoting mental health and better well-being? So mental health and well-being is essential for healthcare. We know that very well by now to provide higher quality. And this could be by two levels. So we'll speak about the individual level, what you can do, and we'll speak about the organizational level. And this is a message from me to all the managers and the leaders there. So on the let's talk about the individual strategies for well-being, and this is something can be done by everyone, not just for the healthcare professionals. So I have give them in the categories like self-care, stress management, emotional well-being, time management, and assessing professional health. In self-care practices, this some of the suggested strategies, methods, technique can be done. We need to have adequate sleep. First of all, let's make sure that we sleep well. We need to have a balanced nutrition, regular physical activity, which actually it's been actually reported that physical activity will help you to reduce the burnout and the stress if you feel the stress and the anxiety. So it helps really, really well. The healthy boundaries also could be a very good decision for you to make to start self-care practice first by yourself. Start by yourself first. The stress management techniques, now we need to learn some techniques about how we control our stress, how we can manage the stress, mindfulness and meditation. If you like some meditation or mindfulness exercises, or you have some methods that make you relax and relieve this kind of anger or distress, this will help you a lot. Deep breathing exercises turn out to be very, very effective in reducing and managing stress. Engaging in hobbies, if you like to do anything that makes you relax and help you to reduce the stress, it will be very, very helpful. I personally do that. Emotional well-being, it's by peer support. Seek for help by your friends, family, your managers. You'll find some peer support around you. And always remember, there will be someone who always care for you, someone that always will support you. So go for peer support. This could be very, very important and could be very helpful. Professional counseling, if sometimes you feel like you need a professional consultation, go ahead for it and don't be afraid, don't scare. Let's forget about the stigma and the culture of fear. You can go directly for professional counseling. Also, the social connections can help you with your emotional well-being. It can be more socializing activities. You can just go out and just find friends, talk to them, have some activities with them. That would be great for your emotional well-being. Time management and work-life balance. This is one of the important things I believe, that you have to have a good balance between your work and between your personal life, where you can have a regular breaks. Make sure you take your breaks in every work, in every job. There are some breaks. You have to take them between the shifts. You have to take your break. Make sure that you take your break. You have to give a task delegation. Make sure that you give a priority for your task. What do you want to do? Manage your work. This will help you to balance that better, and limit overtime if not needed. Sometimes overtime leading to excessive work, and this will actually imbalance your work-life balance if not needed, of course. Last thing is assessing professional help, which we always encourage everyone that you need to assess professional help if you feel like you need help. You can find all the mental health resources depending on where you are. Like, I'm going to give some examples here in the UAE how you can find the mental health resources. Support groups and early interventions can be very, very helpful when you find out, or when you feel like you're starting to have to suffer from some kind of stress or anxiety or depression. Please seek for help. It's going to be very effective, and the earlier, the better. Now, let's talk about the organizational strategies and how these strategies can be helpful for the staff and for the organization by creating supportive work environment. This is giving a positive work environment, prioritizing the mental health and well-being, inclusivity and well-being foster job, which is giving more satisfaction for the staff and reduce the stress. Organization may also have mental health policies and employee assistance programs. Some institutions also should they actually, this is by the WHO. They are recommending that the institution should implement mental health policies and some confidential counseling services and employee assistance program to provide professional psychological support for their staff. There is also a workload management and flexible scheduling would be great by optimizing workload, offering some flexible scheduling, ensuring that we have adequate staffing level. This will definitely prevent the exhaustion and the mental fatigue, especially at the time that we are there's a shortage in staff. This is actually shortage in staff. That means a more stress on the existing staff. So we don't want that to happen. Let's try to optimize the workload and offering better schedule for the staff. Last one is the psychological safety and open communication, which I believe is one of the very, very important one. Encouraging open discussions about mental health and fostering psychological safety. As we mentioned before, there is always a stigma and there is always a fear of speaking about mental issues. So if you are enforcing and encouraging people to speak about mental health openly, having an open discussion about the psychological factors and safety, employees will feel safe to express their concern without fear of the stigma, and this will definitely enhance the workplace. It will enhance the well-being, and it will actually lead to a better work environment. Something very important I would like to speak about also as the role of the leadership and policies, how the leaders support mental health and well-being. And this is important as it's part of the organization because it starts with the staff. Leadership has an effective role and it should have a well-structured policies to play an important role in promoting mental health and well-being among healthcare professionals. Before I go to that point, I have just to highlight something very important by I think that it's very important to speak about this more, which is something called the behavioral changes. And this is the role of the leaders, managers, supervisors, stakeholders to just take a closer look at your staff. Let's have a small definition of a behavioral change. Behavioral change refers to any noticeable change or shift in the person's act, respond, interaction over the time. You will see as a manager or as a leader, you'll see that there is a change in your staff, on your team. So you must be able to find out this kind of change. This kind of change, it could be positive or a negative one. And this is actually it can be influenced by external factors or maybe internal factors. External factors maybe work environment, stress, for example, workload, or internal factors. It could be mental health or emotions, which is part of this actually. So why I'm saying this? Because it plays a very, very important role from the managers or the leaders to find out this kind of behavior change in the staff. And from there, you can find out what is the problem, how we can fix it. You can have an open communication with the staff and try to help them out. Some of these behaviors or change of the behaviors could be noticeable as increasing in the absenteeism or lateness. Staff are coming late, staff are absent, staff are taking more sick leaves. This is actually an alarming thing that everyone should focus and pay attention to that. This could be one of the behavioral changes. Emotional withdrawal from colleagues or patients. This could be also something can be noticeable. Decline work performance and engagement. Sometimes you give some task for your healthcare professionals. Maybe they decline, maybe they refuse, maybe you can find some kind of resistance. It could be a behavior change as well. Signs of exhaustion and frustration, and you can sense this and feel it in any work environment. So these are some of the things that I really would like healthcare leaders to pay attention more to behavior changes and stuff. Going back to the rule of leadership, there's a lot of rules of leadership, but I'm highlighting the three most important. Them leaders can implement some strategies now that foster resilience, provide support, and create a culture where mental health is a priority. First one, training staff on resilience and coping mechanism. Leaders should ensure that the healthcare workers receive training on resilience, stress management, emotional coping strategies. This will help them to navigate challenges in their profession. Why not give them some workshops, some trainings, webinars, or maybe some professionals, guest lecturers? Maybe they can come and speak to them and educate them more about stress management and emotional coping. Then also we can have some programs that include mindfulness training, peer support group, and psychological first aid. This can enhance professional ability to handle workplace pressure. Another thing they can do, they can integrate mental health support into policies. It could be something as in the policies and something it's a must for everyone. Institutional policies should explicitly this address the mental health and providing access to employee assistance programs, and it should have a confidential counseling services and mental health leave if needed. This is by the WHO. Policies should also focus on reducing excessive workload, implementing fair shift rotation, promoting work-life balance to prevent burnout. There is also a strategy that can be done. It's by encouraging culture and openness. As we mentioned, we have this fear and we have the stigma of speaking about mental health. Leaders should cultivate an open and stigma-free environment. Employees should feel safe discussing their mental health and concern without the fear or the judgment or the bullying from others. Could be a very, very effective strategy. Leaders also can encourage regular well-being checkups or check-ins in mental health awareness campaign, for example, and leadership role modeling by the leaders themselves. The leaders should lead and they should actually act as a role model for them. This can help normalizing discussions around mental health and encouraging staff to seek support when it's needed. These are different strategies that can be done by the leaders and can have a very important effect actually in mental health and well-being. Last thing I want to discuss is the call to action and some resources. By addressing mental health challenges in healthcare, this required a systemic change. And if you are talking about these, if you see the numbers I just presented now, we have higher numbers, and this is actually a high risk where we have to see the risk analysis for that. We have to see what is the pros and cons for that. We have to see what is the impact of that. And if we see them as in a leadership perspective or like a manager perspective, this will definitely affect the organization. So this is the need of change now. We'll always say, what is the need of change? That means, what is the objective for that? We have a clear objective now. We know that we have an issue in mental health for healthcare professionals. Now it's time for change. And this actually requires a holistic, systemic change. And this could be in institutional level, national, international, global policy level. And there is a lot of international policies now that I'm going to go through them. This is initiated by the government, healthcare institution, professional bodies that actually play a vital role in implementing these policies. I'm going to highlight the international policies and the national policies here in the UAE. For the international policies, we have the policies by the WHO, which is the Global Policies of Healthcare Workers' Mental Health, which is actually recognize the healthcare workers in high-risk groups call for mental health service integration into occupational health policies, and they also encourages reducing the stigma, promoting work-life balance, and implementing stress management programs. This is by the WHO, and this is a program or the policy that is applied from 2013 to 2030. In the UK also we have in the National Health Services Wellbeing Strategy. This is from 2020, 2021. It was established at that time. It introduced a mental health hubs 24/7 support for hotlines for all the staff, and this also emphasizes safe working hours, mandatory rest periods, and mental well-being. In the US, also, they have policies for healthcare workforce resilience act in 2021 provides funding for mental programs for frontline healthcare workers and expands access to counseling to peer support program for hospitals. Now, for the national, here in the UAE, we have from the DHA, Ministry of Health, and we have from SAHA. From DHA, Dubai Health Authority, we have the Workplace Mental Health Guidance in 2022. They have the Mental Health Support Service, which is mandate in hospitals and healthcare facilities for all the staff. Employers must provide confidential counseling and employee assistance program, encouraging the mindfulness stress reducing programs and burnout prevention training. This is by the DHA, and the Ministry of Health and Prevention recognize the healthcare workers as a high-risk group for mental health conditions, encouraging hospitals to establish peer support to encourage mental health first aid training, and this was also strengthening occupational health and safety policies to reduce stress-related condition for the staff. Saha, which is actually an employee giving in a policy of employee wellness. Saha is actually an Abu Dhabi health service company. It's a public healthcare provider introducing mental health program for doctors and nurses. This offers a 24-hour, 24/7 psychological counseling, resilience training, and mindfulness program. There's also surveys indicate that 20% of the staff who went through this program have a reduction in their stress level among healthcare professionals. So this is great, and it's actually working very well. So this is related to in general, the national and international policies, and this brings me to the end of the session. But at the end, if you can see here, I'm presenting this empty cup that is telling you can't pour from an empty cup, which is a very, very important message for everyone. As a healthcare professionals, we dedicate our lives to caring for patients and for others. And this exposure of our own well-being, it can be a dangerous thing. We cannot pour from an empty cup, and your mental health is just as important as taking care of others. We need to foster a culture to support and a compassion and resilience that we can create a healthcare environment where mental health is a priority, and it's not just to encourage, but it's a priority. Institution, policymakers, individuals, they have a vital role to ensure that no healthcare workers would suffer in silence. No healthcare worker should suffer in silence. At the end, I'm going to say, take care of your employees, leaders, and they will take care of your patient. This is actually a quote. I think it's by Richard, that you have to take care of your employees. They will take care of your business. If you take care of your employees, they will take care of your patient, of course. Let's all commit to break down all of the stigma, support each other, making sure that the well-being is a priority. Let's share responsibilities, and let's together build a healthier, happier, better future and environment for healthcare professionals. At the end, I would like to say, take a deep breath, prioritize your self-care. Remember, you're never alone in this journey. That's it for me for today. I'm going to be open for some questions. I think we have almost 15 minutes.
Yeah, that's right. Well, thank you so much for a wonderful and informative session, Dr. Iman. This session is definitely helpful for our mental health. All right. Well,
Thank you.
since we are live in all different platforms, social media platforms as well, so we do have a couple of questions from our participants as well. And first, I'd like to thank our participants for their questions and for being, participative in this session. So the first question that I have is that based on your experience as a lecturer handling different students, what are the main factors in contributing to burnout among healthcare professionals?
Okay, we have so many factors. As we mentioned, we have anxiety, stress. But I personally say, as the question was from my personal perspective, is the overload and the long shift hours, because it causes all of these kind of issues: the anxiety, the stress, the STDs, and this will also lead them to more stress. So the long shift hours, if a healthcare professional is spending more than 12 hours in a shift, taking sometimes overtime, this will lead also for definitely a lot of burnout and stress.
All right, well, that's good. I agree with you on that. Thank you. And another one is that what are the strategies can healthcare workers use to manage their stress and prevent burnout?
Breathe in, breathe out, relax. First of all, I always ask the healthcare professionals, everyone, just when you feel like you are stressed, when you are going through something, you need to learn some stress management techniques. There's a lot of techniques now. You can just search it online. You can find them on short videos. There's a lot of professionals now. They're giving different techniques and ways on how to reduce your stress. I'm going to ask always, if you cannot remove the source of stress, you cannot fix it. So let's start first to see what is the reason of that stress, what's the reason of that burnout or this kind of whatever mental issue you are suffering. Find the reason, try to remove that. Let's take that off, and then start on the techniques of stress management. Let's have more of life work balance, and this is also one of the important things that everyone should follow. And again, try to make the things that makes you happy. See what makes you happy. If you have a lovely hobby that you like to do it. If you have a nice quiet place that you like to do and it makes you relax, just go. Just go and do it. This also will help you to reduce the level of stress you have.
All right. Well, I agree with you on that. That's an amazing advice, actually. Find the root cause of your stress so that we'll be able to find the right solution
Exactly.
as well.
Just cut out the
Yeah.
reason of the stress. Yes.
Yes, exactly. All right. And another question I have here is that um, how can hospitals and healthcare organizations support the mental health or mental well-being of their staff?
Okay. So there are a lot of strategies now are being taken are actually initiated by the hospitals or healthcare facilities, starting with training. We have some hospitals that will provide training as a CPD, that's a continuous professional development, which is a mandatory one as well for everyone. Training on how on resilience training, for example, or time management or stress management. This could be something to apply on all the stuff, not just for the healthcare professionals. I mean, for everyone in the facility. As I mentioned, the training, and there will be also confidential counseling. I mean, they are in hospitals, so definitely they have professionals, psychiatric, psychologists, or those who are really trained in mental health counseling, and they will definitely give you all the help you need. So hospitals now also providing a confidential counseling for everyone who seeks for help. The most important thing that seek for help. If you feel like you need the help, you should speak and you should seek for it. You should not be ashamed or shy, or you should not be feared that this may lead you to something else. You should speak actually, and you should talk, and the institution will definitely support and help you.
Awesome. That's great. That's true. Anyone who is undergoing something, always seek for help. It is very important that we seek for help. And I like the idea of
Absolutely.
training, actually. because in that training, sometimes apart from I am being helped on in terms of my well-being, I also get to learn new things. So actually, it's
Absolutely.
a great
And I'm going to tell
advantage.
you something. You
Mhm.
don't know what's going on. There is a lot of trendy things now, new things, a lot of researchers are giving us a new different techniques. So you don't know about it. But if you're keeping updated by that, we'll give you training, we can give you some kind of webinar, we can give you some session about the new techniques and the new things that you can do. This will be very, very helpful for you.
Okay, yes, that's great. Thank you for that. That's really wonderful. Now, I have another question here that, a lot of people could be experiencing mental health challenges without them knowing it. What do you think are the early signs of healthcare worker who are experiencing mental health challenges?
Well, forget about healthcare workers, for everyone. If you feel
For
like you're
everyone,
going
yeah.
to, yeah, if this, because this is a common thing. If you feel like you are dragging your legs going to work and coming back, that's an issue, right? So you don't have the motivation. You feel the anxiety, the stress. You're scared. You're afraid. There are some small, tiny signs you may not notice them. Like, for example, I feel like I don't want to go to work today. The first one. Okay, I think I feel sick, and whether you're not sick, I'm going to take a sick leave today. One sick leave, two sick leave, three sick leave, there is a problem. You're not actually, you don't want to go. This is one thing. You don't feel like working. You're not giving 100% in your work. You just want to do the work and just get out of there. This could be some sign of them. And you will see also some kind of resistance in when they give you a task or they start to appoint you to some different task or a job, you feel like a resistance, you don't care. All of these are small, tiny signs. It could be an issue. And this not just related to mental issue, it could be an environmental work issue. And as I mentioned, leaders should pay attention to these kind of behavior change on their staff. Once they see this kind of behavior stuff, this could be also the beginning and the signs of there is an issue here. It may be a mental health issue.
All right, that's amazing. Thank you. Well, guys, in that case, then watch out for these early signs because you might need someone to talk to or support so that you can seek support immediately. Another question that I have here, because we talk about individual, but also we also have like corporate factors or organizational factors, like what you said. So,
Mhm.
what are the role do leadership and management play in fostering a positive mental health culture in healthcare settings, or in all different settings, actually, in corporate
Yeah.
settings?
Yeah. Well, I would prioritize good communication, open communication, an open discussion between leaders and the staff. It's not necessary to be a wide, big communications or discussion, but at least you are not scared, you're not afraid to say, I have a problem. Leaders should, as I mentioned, leaders should find out and see the behavioral change, and they can actually figure out if the staff is suffering from something. Communication between them will definitely help and will help them to reduce this kind of burnout at least, or this kind of stress. And again, when we say peer discussions, that means when you're talking to somebody, maybe your colleagues, maybe your leader, maybe your manager, when you speak about your issues, mental issues, this will help them as well to make some decisions related to your job or to your work. Maybe they change your shift, maybe they give you a leave, maybe they give you more training, maybe they send you for consultation. This will definitely help you. So leadership have a major, major important role in maintaining the best in their institution, especially when it comes to mental health and well-being.
All right. Well, thank you so much. I hope all the organization would hear what you're saying right now and value their employees. I really appreciate that. I could
Thank
not
you.
get enough of this conversation. I want to have more, but unfortunately, we don't have a lot of time. But thank you
Yes.
so much, everyone, for attending. One of the topics that was discussed is actually exhaustion, and exhaustion can be different sources. And one of the examples of getting exhausted is choosing the right programs. Sometimes when we are young, students have a lot of options, a lot of universities to look out for programs to choose from. This can be very exhausting as well. And that's why my name is Rito. I'm one of the admissions and academic counselor at GBS Dubai. We are here to help you out, find out the best program that you will be eligible for, the different programs, scholarships that you could be eligible for as well. So we are here to help you out. And just to let you know as well, we don't just offer healthcare programs, but we do offer different kind of programs. It comes in different format as well, online or on campus. We have business, IT, digital technologies, international business, healthcare management, construction management, and we will help you in terms of admissions process. We provide seamless admissions process. All right. So my name is Reno. I'll be sharing my contact details with you, or you can send an email to inquiry@gbs.ac.ae in case you need our support. So seek support, just like what Dr. Iman said, seek support so that we can help you in terms of looking for the right program that is more beneficial for your future. All right? So I'll share to you my contact details through chat. Okay, and email address as well. So if you have questions, if you want to have counseling or consultation, feel free to send a message, or we are open from Mondays through Fridays. We are located in Dubai Knowledge Park from 9 a.m. to 5 p.m. and we will be happy to meet you personally and have a face-to-face consultation. All right. Thank you everyone for joining.